The autonomic nervous system is a subject that lots of people seem to have some difficulty with. So don't feel bad if you're one of those people. It can help when you're thinking about what is the autonomic nervous system, right? It can help to remember that autonomic means automatic. So these are all of those things your body does without you thinking about. Your heart rate, your blood pressure, your breathing, digestion, using the bathroom. All of these things are affected by your autonomic nervous system. So it's divided into two sections. The first of these is a sympathetic nervous system, and the second is a parasympathetic, in no particular order. The sympathetic is it's the fight or flight, and the parasympathetic is the rest and digest. Some people have difficulty getting these straight, and they often mix the two up. And the easiest way I've heard to remember which is that sympathetic is a shorter word than parasympathetic. And when you need to fight or flight, you need to do it now, right? So that can help some people remember the difference. So the sympathetic nervous system, like I just said, is the fight or flight system. So what does that mean for the physiological functions of your body? Well, it's going to do all those things you want it to do when you're running for your life, right? Your blood pressure is going to go up. Your heart rate is going to go up. You're going to breathe faster. Not only are you going to breathe faster, but the bronchioles, the tubes inside your lungs, are going to get wider. They're going to dilate. And that's going to make it so it's easier to breathe. More air comes in. Your pupil size is going to dilate. Easy way to remember, like, does it dilate or does it constrict with sympathetic? Some people mix those up. Easiest way is to think you want to see more of what's around you, so the hole under your eyes gets bigger, right? Your blood vessels will do a couple different things depending on where they are. If they're in your muscles, if they're in your brain, if they're around your heart, if they're in your lungs, they're going to dilate and get bigger. So why is it that your blood pressure goes up during a sympathetic response if these blood vessels get bigger? Well, it's because all of your other blood vessels, the ones in your digestive tract, the ones in your skin, the ones in non-important areas like your kidneys, which are important, granted, but they're not important for a when you're running away. These ones are going to constrict. All right, this causes sweating in your skin, right? And it causes your blood pressure to go up. The blood vessels and those other areas, like I said, constricting, that's what I have here on decreasing. Easy way to remember sympathetic response is everything you need right now is going to be enhanced. So your heart, your lungs, your brain. But everything you don't need is going to be shut down for a little while. So it shunts blood away from the non essential organs and it puts it into the essential areas that you need when you're running for your life or fighting somebody or what have you. Running from a bear is what a lot of people use to describe it, right? So your parasympathetic nervous system is your rest and digest system, is what it's often called. It increases peristalsis, which is the movement of food through your GI tract. Um, it increases the vessel diameter, your blood vessels, so it dilates the vessels and the digestive organs, kidneys, and skin. This may sound a little like deja vu, and I hope it does because it literally does the opposite of everything that your sympathetic nervous system does. This is kind of nice as a student because it means you don't have to remember two separate things. You just have to remember one and remember that the parasympathetic is the opposite of everything it does. So pupil size is going to constrict, it's going to become smaller. Blood vessels, lumens, are going to become smaller in the muscles. Your brain is going to be less stimulated, so you might be a little more drowsy, easier to go to sleep. Your heart rate, blood pressure, and respirations are going to go down. Your bronchioles are going to constrict, and your sweating is going to decrease. You're not going to sweat as much. So that's all your parasympathetic nervous system. A big concept that you have to realize is that they exist in a balance. Your heart rate can't go up and down at the same time. It has to choose one. And this is how your sympathetic nervous system and parasympathetic nervous system work together. You can't just do one or the other. They have to be uh, or you have to do one or the other. You can't do just both of them at the same time, right? If you take an anticholinergic and you take an antiadrenergic, blocking the effects of each system, they're going to cancel each other out and you'll essentially be the same. So think of it like a seesaw. If one goes up, the other must come down. Now here's the interesting thing. If you block one and make it go down, the other one has to go up. So whatever one does the opposite. So the pharmacology, luckily for these drugs, is relatively simple. All right, I'm not going to get into the list of all the different cholinergics and anticholinergics, but we will talk about the important ones. So adrenergics are named because they affect the sympathetic nervous system. And the main neurotransmitter in the sympathetic nervous system is adrenaline or epinephrine, giving it the name adrenergic. Cholinergics affect the parasympathetic nervous system. Why are they called cholinergics? Because the neurotransmitter that affects the parasympathetic nervous system is acetylcholine, and the choline gives it the name cholinergic. So naturally, a drug can either activate one of these or deactivate them, and it can either be a sympathetic or parasympathetic drug, meaning there are 4 categories of drugs that affect the autonomic nervous system: adrenergics, antiadrenergics, cholinergics, and anticholinergics. Makes perfect sense, right? So that's all there is. If you have an anticholinergic, it will block the sympathetic. So it's going to act as though it were an adrenergic. So you'll get increased heart rate, increased blood pressure, decreased secretions in the GI tract, things like that. Popular use of these might be before surgery. They might give somebody something like atropine, which will make it so that there's less secretions throughout the GI tract while they're doing surgery, less saliva, and stuff like that, right? Less peristalsis in the GI tract as well. So they're not going to have a patient who's farting on the operating table. There's more important reasons, but you get the idea. So atropine is often used as the anticholinergic, but what if you give them too much? Then you need an antidote. So you have to know some common antidotes as well. Atropine is often used, as I said, for surgery and stuff like that, and its antidote is physostigmine, which is a cholinergic. Now, atropine also is an antidote. It's used to treat organophosphate poisoning. Organophosphates are used in like insecticides and stuff like that. So, if organophosphates are treated with atropine, what do you think organophosphates are? So it could be tempting, since an anticholinergic has similar effects to an adrenergic, to think that if we give a cholinergic and we want to cancel it out, we just give an adrenergic. It's better to give the anticholinergic, though. The reason is that treats the problem directly, whereas an adrenergic just treats it indirectly. It's better to handle the problem at the source than it is to indirectly treat a problem. Alright, so I hope that this video was helpful to anybody struggling with this part of the nervous system. And of course, if you have any other issues in nursing school that you want me to discuss and maybe make a video on, get down and dirty and just explain the important details, please let me know in the comments below. Like and subscribe, and I'll pump out more videos as you guys need. Thank you very much.